Most men reach their 60s carrying a quiet question they rarely ask out loud, not because it is shameful, but because no one ever explained it properly. The question is simple. Is frequent ejaculation still safe for my body at this age, or is it slowly draining my strength? Some men worry they are harming themselves. Others worry they are losing something vital. And many receive confusing advice. Some say it is unhealthy. Others say it prevents disease. The truth, medically, lies in understanding how the aging male body works, what ejaculation actually does inside the body, and how frequency interacts with hormones, nerves, muscles, the prostate, the heart, and the brain after 60. After the age of 60, the male body is not weaker, but it is different. Testosterone levels are lower, recovery is slower, blood vessels are stiffer, and the nervous system takes longer to reset after stimulation. Because of this, activities that once felt effortless now require more energy and coordination. Ejaculation is not just a local event. It involves the brain, spinal cord, pelvic nerves, prostate gland, seminal vesicles, muscles, hormones, and cardiovascular system. When ejaculation happens, the body releases dopamine, oxytocin, prolactin, and endorphins. These chemicals affect mood, sleep, motivation, and energy. In younger men, the system resets quickly. In older men, it resets, but more slowly. This difference is what determines whether daily ejaculation supports health or begins to feel draining. Let us first understand what research actually shows. Large observational studies published in urology and men's health journals, including long-term cohort studies, have examined ejaculation frequency and prostate health. One well-known body of research observed that men who ejaculated regularly, defined as several times per week, had a lower risk of prostate cancer compared to men with very infrequent ejaculation. The proposed explanation is that regular ejaculation helps clear inflammatory secretions from the prostate and reduces stagnation within the gland. This finding is important, but it does not mean more is always better, especially after 60. Research does not say daily ejaculation is necessary for protection. It says regular ejaculation may be beneficial. Now let us talk about hormones, because this is where many myths exist. Ejaculation itself does not significantly lower testosterone long-term. Multiple endocrinology studies show that testosterone levels fluctuate minimally with ejaculation frequency. However, what does change with frequent ejaculation is prolactin, a hormone released after orgasm. Prolactin creates the sense of relaxation and satisfaction after ejaculation, but elevated prolactin for prolonged periods can reduce libido, motivation, and energy. In younger men, prolactin levels normalize quickly. In men over 60, normalization takes longer. This is why some older men report feeling sleepy, mentally dull, or less motivated when ejaculation is very frequent. Another important factor is the nervous system. Ejaculation requires coordinated nerve signaling between the brain and pelvic region. Aging naturally reduces nerve conduction speed. When ejaculation occurs too frequently without sufficient recovery, the nervous system may feel overstimulated. Clinically, this can present as pelvic fatigue, reduced erection firmness over time, or delayed recovery between erections. This does not mean damage is occurring, but it does mean the system is being pushed more often than it comfortably resets. Energy is another concern men often mention. Semen production does require nutrients, zinc, amino acids, fructose, enzymes, but the nutritional loss itself is small. The real energy cost comes from neurological and cardiovascular activation. Heart rate increases, blood pressure temporarily rises, and muscles contract rhythmically during ejaculation. For a healthy man, this is safe. For a man with heart disease, uncontrolled diabetes, or severe fatigue, daily ejaculation may feel taxing. Cardiovascular studies show that sexual activity is equivalent to mild to moderate physical exercise. Daily moderate exercise can be beneficial, but only if recovery is adequate. Sleep is an interesting area where research shows both benefit and caution. Ejaculation releases oxytocin and endorphins that promote relaxation and sleep onset. Many older men sleep better after ejaculation. However, if ejaculation is followed by poor sleep due to late-night stimulation, screen use, or overexertion, the benefit disappears. Chronic sleep deprivation worsens testosterone levels, insulin sensitivity, memory, and mood. So the context matters more than the act itself. Prostate health deserves special attention. The prostate enlarges naturally with age. Regular ejaculation helps keep prostatic secretions moving, reducing congestion and discomfort. Urologists often observe that men with very infrequent ejaculation experience more pelvic pressure, discomfort, or prostatitis-like symptoms. However, daily ejaculation is not required for this benefit. In fact, some men with enlarged prostates may experience temporary urinary irritation if ejaculation is too frequent. Balance is key. Psychological health is another layer. Sexual release reduces stress hormones like cortisol and improves mood. Studies in psychoneuroendocrinology show that regular sexual activity is associated with better emotional well-being and lower rates of depression in older adults. However, when ejaculation becomes compulsive or disconnected from emotional intimacy, the psychological benefit diminishes. The brain responds better to meaningful stimulation than repetitive stimulation without satisfaction. Let us address the fear many men have. Am I weakening myself? There is no scientific evidence that ejaculation weakens bones, shortens lifespan, or drains vital energy in a literal sense. However, perceived weakness can occur if ejaculation frequency exceeds recovery capacity. This is similar to exercise. Moderate regular exercise strengthens the body. Excessive exercise without rest leads to fatigue, inflammation, and injury. Ejaculation follows a similar principle after 60. Medical consensus does not define an ideal number because bodies differ. A healthy, active man with good sleep, nutrition, and cardiovascular health may tolerate daily ejaculation without issue. Another man with diabetes, hypertension, poor sleep, or low testosterone may feel depleted if ejaculation is too frequent. The body gives signals: fatigue, low motivation, reduced erection quality, irritability, poor sleep. These are not signs of harm, but signs of imbalance. Importantly, abstinence is not inherently healthier either. Very long gaps between ejaculation can increase pelvic congestion, irritability, and reduced libido in some men. Research does not support extreme abstinence as a health strategy in older age. Regular, comfortable sexual expression supports mental and physical well-being. In clinical practice, men over 60 who feel best sexually and physically usually follow a rhythm rather than a rule. They allow recovery, they prioritize sleep, they manage stress, they maintain physical activity and muscle mass. They understand that sexual health is part of overall health, not separate from it. So what really happens if you ejaculate every day after 60? Medically speaking, nothing dangerous happens by default, but whether it helps or harms depends on your recovery capacity, health status, and lifestyle. For some, it supports mood, sleep, and prostate health. For others, it may cause fatigue, reduced desire, or slower recovery if done without balance. The goal after 60 is not frequency, it is sustainability. Aging is not about stopping pleasure. It is about learning the body's new language. When men listen to their body instead of following myths or comparisons, sexual health often becomes more satisfying, not less. The healthiest approach is not fear, not excess, but understanding.